Hello and welcome everyone. I'm Sharad Kamra from Crack the Wellness Code, and we are here for yet another interesting and insightful session. This time the theme is for senior citizens, the elderly. And so we have with us again a wonderful expert, Dr. Varun Pratap Singh. Dr. Varun Pratap Singh, those who have attended the previous session also must be knowing him really well. So to talk about him, he is got a career spanning of around 12 years, and he has been donning many hats. Along with being a physiotherapist, he's an ergonomic and posture specialist. He's a Pilates trainer. He's a corporate ergonomic trainer, osteopath, and manual therapist. And he's also an expert in trigger point dry needling treatment. He's also former visiting consultant physiotherapist at Essential Services, Gurgaon, as well as Noida. He completed his Masters of Physiotherapy in Orthopedics from CCS University in 2011 and received his training at GB Pant Hospital, New Delhi. He is a fellow of osteopathy and manual therapy from Australia and a certified manual therapist in spinal manipulation techniques. He expertises in trigger point dry needling, trained by Dr. Jeremy Lewis, who's a shoulder expert, and London Shoulder Clinic, and also certified as tutor for the shoulders. He has a diploma in family health education and a certificate in health education. He has served as a visiting consultant to many other corporates during his career of 12 years and has conducted many workshops, seminars, and trainings on workplace ergonomics. Stress management and basic first aid training are some of the areas where he has conducted programs for MNCs like Schneider Electric, Accenture, Larsen & Toubro, Vedanta, FinServ, Sopra Emerging Ventures, First Blue Home Finance, and so many. So without going into much of details, here we have with us our very own Dr. Varun Pratap Singh. Dr. Varun, welcome, hearty welcome. And thank you so much for sparing time. And it's been great, the previous session that we had related to posters, that was again very well received by our participants. And again, this session, as we discussed in our interactions, what we face really nowadays is the aging symptoms amongst people. And those aging symptoms, what kind of challenge it brings for all of us, and especially at homes, how, and what kind of care can be taken of those elderly. Normally, what kind of things we often hear is someone has fallen in the bathroom here or there, and then there was some injury. Gradually see so many challenges coming amongst, elderly after this first fall experience is a shaky confidence, losing grip over the body. Maybe they become more conscious about, the way they walk. So my question to you is that, on the first hand, so when these people come to you for the first time or any such cases reported to you, how do you proceed?
A very good morning to you all. I welcome you all on behalf of Crack the Wellness Code India. It is very rightly said, sir, whenever, somebody who has crossed the age of 55, 60 years, they do come to us. The first and foremost thing, what we tell them is to make their life actively, motivated, and you must make your body to move. That's the first thing what we tell them. Because as the age progresses, our movements tends to go slow. We try to go, in a very subnormal way in terms of activities. So the first and foremost thing we tell, just move your body. So that's the first thing that is, required. And then, of course, once they are realizing this thing that, we should not sit most of the times or lie most of the time. So we must do move as much as we can.
Okay. So, Dr. Varun, when these instances happen, bathroom falls and all such kind of things, often it happens that, people are not prepared at home. They really often don't know what really to do. Karna kya chahiye. And of course, the first aid can be given, and post that, what should really change at home? How should family members look at it? And how they can, bring the confidence back amongst, the elder. So what exactly you think, can be the steps for that?
So the first and foremost thing is, we must be aware, like, once we are getting, older every year, and our age is like, we have crossed 60, 65. So we must be aware, like, what are the important things that we have to keep, like, to maintain our balance and coordination. So that awareness is first of all, required. Either, you're just getting those trainings, or you're getting that information from internet, from some professional, from physiotherapist or anyone. So that's the first thing. Second thing, then you must have the awareness, like, about the design of your bathroom. What are the support systems required in your bathroom, and, how should be the floor, and, what should be the height of the toilet seat, what should be the height of, your bathroom sink. So all those things, awareness is of important priority that has to be taken care. And once you are aware, then of course you must aware, how much, percentage of your balance is going with age, or the coordination is there or not. So then you can improve those things with the help of some exercises and few other factors. You can take care of all those things, and then slowly and gradually you can improve your balance and coordination, and you can reduce the risk of just, having the falls in the bathroom.
Okay, so that's very interesting and insightful point you brought forward. I mean, maybe you're talking about changing the tiles or something. So what exactly do you suggest? And, certain bathrooms, we see that, as people age, they put certain extra handles or such kind of things. And then, there are factors such as, say, for example, people often have a habit of latching their doors, and when the elderly has had a fall, and then the door is latched, they may not be in a position themselves to get up. So what should change at home for them? What can be done in specific terms? Say, like, maybe, for example, you're saying that you should use non-slippery tiles. What else are specifics you suggest, should change at home?
So starting from the first thing, whenever, because, everybody is aware. So once you know that, you are not able to maintain the balance, or the family members knows that, something is there, that the person at my home, my family member, my, elderly, they're not able to maintain the balance, or some problem is there, maybe because of some medication. So we should tell them they should not close the door. That's the first thing. Second thing, of course, non-slippery tire should be there. That's the, second component is there. Then the floor should be always dried up. It should not be wet at all, because that's the important factor there. Even if you're using a slippery tiles, non-slippery tiles, so the important thing is the floor should be dry. So every time you're going over there, you're using, so somebody should help them out to dry up that floor. That's the important component. And of course, sometimes, the elderlies are overconfident in terms that they sometimes stands without the support. They think that, they are able to do all those things. But what happens with age, there is a postural hypotension also happens. So whenever they're sitting onto the toilet seat and they get up, immediately their BP falls. Or there, because, once your age is more, so somehow you're taking one or the other medication of BP, diabetes, or some other medication which involves some kind of sedatives, some kind of anxiety pills. So all those things reduces your balance. All those things create incoordination to your brain and your system. So the important thing is, even if you are confident enough, I'm not saying, having a confidence is the wrong thing, but the important thing is that you must, go ahead, and you should take the support of the things which is nearby to you.
Okay.
So that's the important thing that has to be taken care. And of course, then you must realize that, there is your bathroom is adequately equipped with the things which will help you out in getting up from your toilet seat, or taking the help of, when you're standing at the side of sink, or you're grooming yourself inside, the bathroom, or you're doing the activities of daily living in terms of brushing your teeth or some other activity in the bathroom. So you must always take the help of one hand. So those using the hand with support or placing your hand over to the sink should be there. Or once you complete the activity, like you have done the process of your washroom, you're sitting onto the toilet seat, you must call for some help. Help in terms, the person will stand side by you. They will not hold you, but they are standing side by you. By that time you finish, you wash your hands, wash your face, groom yourself, or do whatever activities. By that way, you can prevent that fall. So what happens? It takes just few seconds that your balance loses. So as the age progresses, there is a degeneration in the brain in terms that your brain is not working according to as it was working earlier. So the nerves their conduction gets slower up. Your muscles are not performing the action accordingly. So everything reduces. The reaction time. Basically, we work on reaction time. So the reaction time, the reflex system reduces. So earlier, like, if your age is 50 and somebody pushes you, you just suddenly grab something and you just, get steady. You maintain your balance. But once your age crosses like, 65, 70, it depends again. Somebody is at the age of 80 also, they're such active, alert, and their balance is also good. So they're able to hold, but still everything reduces. The reflex action, the reaction time reduces. So you're not able to hold those things. You're not able to maintain the balance. So a support side by you. If somebody is there, sometimes the people say we are alone. Nobody's there in my family. Then of course you have to take care of those things, like just have those equipped systems in your washroom, which have some grab bars, some stick, some walker. All those things should be there with you if you are alone. Or I would suggest you, there is nothing like that you should feel ashamed of, that you're using walker, stick, or some help. So if somebody is not there with you, keep those things with you, even if it is of no use. So it is lying down side by you, so you can take help of it and get up. And I always recommend, when you are sitting on either on bedside, you get up from the bed and sitting. When you're using the washroom loo and you're sitting on the toilet seat, slowly and gradually, first of all, get up at the same place. And when you get up at the same place, just maintain 10 to 15 seconds at the same place. Do not move. Stop there so that your blood pressure, manages your entire system. Your brain takes that reaction. They are able to hold it. They are able to maintain the balance. So 10 to 15 seconds, stand at the same place, or probably like 20 seconds. So once your system is confident, you might be confident, but your brain is not confident. So by that time also, your knees, your ankles, they have got a proper proprioception, and you are able to take the first step. And moreover, when you are there in the washroom, you should not get hurried up. Take small steps and see. आपको चक्कर तो नहीं आ रहे हैं. If you feel so चक्कर आ रहे हैं, sit down again. So that's the thing that you have to take care. Moreover, if somebody, you had a fall inside the washroom, the important thing is, don't try to get up from that place. First of all, you see, is the pain very severe, or you feel some swelling or unusual? So you try to call somebody. If somebody is not coming, then it's a different issue, but still lie down for some time or sit down over there at the same place. The next step is, wherever you feel injury, if you feel the injury in right knee or left knee, you should not put weight on that leg. You get up, be seated at toilet seat or chair or on the floor. And then you can open the door if possible, or if you have got some mobile phone inside over there or some phone, you can call for some help or open the door. So you can drag yourself. What happens, suppose you had a fall and you try to get up. So there may be some kind of fracture also has happened to you. So people, even if it is undisplaced and you try to just get up, it get, displaced. Earlier it was in its position, but you tried, to get up from there, it got displaced. So, that thing you have to just take care over there also.
Okay.
And
Understood.
probably, like, I also recommend whenever you're going inside the washroom, you should have some emergency, bell or some phone which is readily available. Or nowadays, there is some phones available where you have got SOS button also. Okay, there is some specific phone, even, you say that you're alone in the family or two people are there and nobody's there outside you. So you can call, your neighbor or somebody who's there. So you can press that button inside the washroom only so that they can come or they can help you out someday.
Okay.
So these are very small
Often
things
we
that
have those hotline on the mobiles also. So, you've rightly said. So, there's something, which makes it very easy for people to access. And very valid observations, like, not to close the bathroom doors, not to latch it, and then, keeping a way of communication, active, and then staying in, whatever position you are for some time. So that, you get back into your senses and then, see, where your physical condition are, and accordingly decide whether there's no feeling of injury or pain in any of your knee. So that brings me to a question here, that one of the areas where the weakness is felt first is the knees amongst the elderly. And because of the imbalance, a lot of time we sense that people have some kind of shivering and losing balance because of this very weakening in the knee joints. So what do you suggest? I mean, whether they are taking bath or anything, should they be wearing something around their knee if it is already noticed, or what should they do?
generally, I don't recommend any kind of, those orthotic aids. If you feel pain or discomfort, I try to tell the, person that, you become more active, you do the exercise for that particular joint. Because
Okay.
when you're taking the help of those things, they further reduces your muscle strength. But that does not mean that you are not going to use those things. Supposing you are having pain and swelling, of course you are going to use it. Okay. But
Okay.
for specific time, for 10 days, 15 days, 20 days, but sometimes what happens, it becomes habit for them.
Yeah.
They try to put some collars, some knee caps, some ankle caps, some elbow caps, which is a wrong
Absolutely.
habit. So you must not,
Yeah.
because something is supporting you over here. So your muscle action is hampering. So the muscle is not able to perform. If you have got pain, 10 days, 20 days, month, agreed. But after that, you have to start moving your joint. You
Absolutely.
use, some
Yes.
activities so that
Mhm.
the muscle will start performing its action. And really telling you, no age. There is no age bar at the age of 80, 85. I've seen my patients at the age of 90 also. They are very active. Sometimes the person at the, I've seen some patient, they say that the 65, up to age ho gayi hai, what should we do, and this and that. So I tell them, I have got a patient of 95 years, 100 years, 98 years, 93, 85, 90, and they're such a, highly active. Active in terms, of course, they're not running, but they're able to perform the activities of home. They're going to the market, they're going downstairs. So, but they're mentally, physically active. So I tell them to get motivated to see those people, not, at the age of 65, 70, you say, no, my family mein koi nahi hai, somebody is abroad and this and that and XYZ. So conditions are, whatever there is, it is. So you cannot change those conditions. But for that reason, your brain will affect, and from your brain, your body will affect. So those things you have to take care. You cannot say that, again, those thoughts, small thoughts will create a weakness in your mind. And you're out of your mind means, again, it is a chance that you're going to lose the balance easily because your mind is somewhere else. You're not able to concentrate and your muscle and nerves will not perform its action. So, remove those things, get motivated, join some organization, watch TV, watch whatever you like, get involved with your, neighbors, do a lot of activities so that your time will be just, managed with that way. Your mind is not thinking that way. You are happy. Your good hormones are releasing. Your muscles are in action. Your brains are performing very well. Your body feel good.
Okay. So, Dr. Warren, like you rightly said, the movements, the exercises are very important. Often we see that, I mean, very rightly you said, they should remove those orthopedic aids. And often we see that, people do the reverse. They refuse to take any, crutches or, such kind of support to get up, the stands which they have for elderly. but then they keep wearing the collars around the neck, and they keep wearing the bands, orthopedic band. The question is that movement is hampered, and that movement has really to be there for them, to be able to recover from whatever initial challenge they had. The question is, what exercises, movements can help them to regain their flexibility also, and whatever pain was there, once it is gone, there's no inflammation. So what they should start doing now? What kind of exercises would help?
Okay. So for that, I would like to share my screen and just show you some of the exercises.
Yes.
Okay, so the first thing, if you can see inside, this picture, so this lady seems to be quite older, but she's able to perform, the balance exercises. And of course, this balance is not only balance, it is a coordination of the brain, muscle, joint, ligament, nerve, entire thing is involved in system. So basically, I'm not saying that you people must do all those things, but this is one of the things that once you challenge your body and brain, so the more challenge is going to your brain, the better is your balance, the better is your body response, the better is your reflexes. So you will improve. Okay, so balance once your age increases, so balance automatically reduces. There are a lot many factors by which there's a degeneration in the brain. You're taking a lot of medications. So nerve system, the joint systems, the conduction gets slower, and there are a lot many other factors. And moreover, you're not that active, you're not doing those exercises, so everything gets reduces. So slowly and gradually, first step is to move and then start some basic exercises. So we'll just go ahead with those things also. So again, this is mentioned that we have to prevent the risk of injury, especially in the elders, because as the age progresses, there are likely chances they have got dementia, delirium, they have got Parkinsonism, they have got lot many other diseases also once your age increases. And arthritis is one of the things that you cannot prevent. The osteoarthritis, definitely your age is increasing, there are joint changes happening, and your balance automatically reduces. So then there are some geriatric symptoms. We see the fall fracture, surgery, fertility, delirium, urinary incontinence is one of the problem. One more thing I would like to just mention over here. So what happens? The urinary incontinence is one of the major problem in elderly. But sometimes the elderly says they're not happy wearing those diapers and all those things. They feel ashamed or they don't feel happy about it because diapers is something you should not wear, because Indian mentality is entirely different. They want to be very active, healthy, and they should not be dependent on anybody, not on their children, not on their servants or anybody who's helping. So, but I would recommend them that you must, if the things are like that you have to be wear the diaper, you must wear it. It is not a taboo. It is not some restriction, because because you're lying down on bed, you're sitting, it takes time for you to go to the bathroom. Okay. So, but by that time you'll be reaching, there is an incontinence, there is a leakage of urine, and the entire clothes gets wet up. So you must, if the things are like that, you must use it. You should not feel ashamed. You should not feel bad about it, because jab age badhta hai, to then the things are like that only. You cannot control those things. So if it is like that, you must wear it. So then there are sleep disorders, then there's a lot of pain in different joints, body pains, difficulty in swallowing, vision impairment, arthritis, osteoporosis, diabetes, and a lot many other disorders. Again, these things can be controlled, but if you just take care of your body in terms of doing some physical exercises, in terms of some yoga, meditation, pranayama, So there are small changes which, happens to your lifestyle or nutrition in terms, as your age progresses, you say, I don't want to eat. मेरी अब खाने की डाइट बहुत कम रह गई है, मैं ये भी नहीं खाऊंगा, मैं ये भी नहीं खाऊंगा, मन नहीं करता है, एसिडिटी होती है. So there are lot many factors also, but reducing your nutrition reduces your muscle strength, reduces your entire system physiologically also and anatomically also. But for them, I always suggest consult somebody who can tell you the ways by which you can reduce your acidity or passing your motion or some all those things. You must consult at least once. So they say no, you are taking allopathic medication. So every time the allopathic medication does not help you. So sometimes you need some kind of physical exercises or yoga or some kind of asanas which helps you in passing your motions or controlling your urine, all those things. So you must consult somebody. So whosoever is there. Then this important thing which we were discussing about. So this is the gait cycle while you walk, a normal person. So at what time your foot is spending some time onto the floor while walking. So we are not able to realize, but this is the entire system. So as the age progresses, our balance, in the sense the support time to the floor reduces, and our foot is not able to maintain that balance. So there are a lot of changes which are happening. So this system reduces and the balance, worsens up. But these are very smaller things which you are not able to recognize it. But of course, you can see those, things by using, when you stand, at a place, hold something and lift your one leg up. So one leg up in the air and then you hold. Then you see, are you able to maintain the balance? Then leave one hand and see what is your balance. Tell somebody who is standing behind you. Then leave both hands. Then see what is your balance. So this can be exercise also. This can be used as assessment also. So raising your one arm up, two up in single leg. So it is an exercise also for your brain and coordination for your knee, ankle, hip, back. Whole lot of things are there. So this is one of the exercises also. So that can be used. So then again, manage and avoid bathroom falls. I told you have to improve your strength, balance, flexibility. And every week you must do exercise at least 3 to 5 days a week. If you're not able to perform 7 days a week, you must do exercise 3 to 5 days a week and then some walk in morning or evening. So this I was mentioning about you, the equipments can be used, some kind of grab rails over here, side support system, then this back support also and sideways while you're standing. So these are also available in India, at hardware stores. And if you're not able to, find it out, then you can order them. They can just have those systems. But you have to find out the.
You got on mute, Dr. Varun. Dr. Varun, you're on mute. Dr. Varun, we are not able to hear you.
You try to just take the shower only. But I always recommend use some chair so that you have just done that. Then there is some dry chair where you can sit and change your clothes. So this is also what I just recommend. Then there are some, the fall prevention. These are the something which you can just use it. What happens because of medication, your balance reduces. With exercise, you can improve your balance. Even if your vision is not good, your balance reduces because you're not able to see the objects rightly. You're not able to see the floor at proper level, or there is a stairs. You're not able to see some object is there. So these all things. So if your just vision is there, then you can get your specs checked, or you have got some number. You can use that. And there's some exercise for the eyes also. Then you can do it. Postural hypertension I've already mentioned. Heart rate and rhythm, it can be because reducing the BPRs, you're taking the medication for the same, or you have some got heart problems. So you have to be very much aware that you have got lot many problems. So how we can improve? Again, if you do the exercises, your heart and rate and rhythm can improve. Then check your vitamin D, magnesium, calcium levels. Not only vitamin D, magnesium and calcium levels also. If there's low, you can take the combination of magnesium, vitamin D, and calcium both. Footwears, I always recommend use non-slippery, slippers at home, or wear shoes as much as you can, and outside also, and change your shoes every 6 months or a year, or maybe depending on the quality. because you should not use the old shoes which have got, the sole which is, not even. So you have to check the sole, or again, you consult somebody that, whether my sole of the foot is fine or not. I'm not saying that you wear hard or soft or whatever, because whatever you're wearing from many, many years. So you must take care of those things. Then home environment in terms of, having support system, like while you're having your lunch, dinner at dining table, supposedly sometimes people have got, a very soft kind in the sense, it is not very heavy that where you put your weight onto the table and you get up and your chair is, not very heavy, very lightweighted, where you can have again the fall and rest of the things in the home if you're working in the kitchen. So we have to assess one or the other thing. If you're not able to find out, go onto the internet, find out the ways that you find difficulty in doing those things, or you can talk to me, or you can talk to somebody else who is nearby to your house or online. So you find out those things, whether it is right, because you're finding difficulty. But actually, you have to be just find out whether it is right or wrong. So again, you have to maintain the practice the balance and coordination exercises, which will really help you out. So this is one of the exercises we have come to the. So I would say this is a tightrope walk. So you can do that. The important thing is you're bending your knees. So I would say you can do the small squats in terms, rather than you're not able to do that, do mini squats. You bend little bit and you get up. You bend little bit and get up. This is the mini squats. And of course, then you make a straight line. Straight line as in use a reference line, either your tiles or something else. So you walk parallelly to that line. But again, if you're having some balance difficulties, tell somebody to stand by you, next to you, so that you should not, because these are the exercises which is not easily performed. So first of all, that's why we can start with the squatting, mini squats, then you get up, mini squats, then you get up. So that's the first thing. Again, everything is dependent upon how much good balance you have. If you do not have, then you start from the bed exercises. Then you can just go ahead with one by one. Then rock the boat, in essence, again, it is a single leg standing. I told you, you can use some railings, some grab bars, some table support, some chair support, or somebody standing in front of you who can hold your hand, both hands, and then you raise one of your leg in the air. Then you can take that leg sideways also. So that's the, again, second exercise, which can be really helpful. Then flamingo stand, again, you're just bending the leg. It is not necessarily, because once your range is more, you can, use your leg in terms of front side, sideways. So whichever direction allows you the movement to happen. It is not necessarily that it should go straight or sideways. No. The point is that you're able to lift one leg. You're able to maintain balance. That's the important thing. So we have to take care for this flamingo stand. Then beanbag balance. So you've got a beanbag. So you place it beneath you. You can use that way also. And there are a lot of things which we can use. Beanbag can be used for pressing the beanbag like this, so that you can have strengthening for your shoulder, elbows, neck, or you can use it upwards. Like, supposing this is the beanbag. So we can use it, this way, press it and hold it there for 10 seconds, 15 seconds. Though it is a bigger size, so you can reduce the size also. So you can press it like this, or you can raise like this, or place some object of 1 kg, 2 kg over this, raise like this, sitting like this, you can turn and rotate, or you can rotate your body moving like this. You can use it in different direction. This is just in sitting. So this small exercises really helps you. So I'm not saying just do some exercises, running, jogging, no, nothing like that. Start with smaller things. So those small things, proceed for 1.5 months, 2 months, 3 months, then add some more exercises. So with beanbag balance also, you can do many things. Then heel to toe walk, I suggest only once you are improving. You have been doing the exercise for 5-6 months or 3 months, your balance is good, you do tiptoe, one leg, then your heel, then again your heel, but again somebody there should be there with you. It cannot happen that nobody is there with you and you're performing this. You can again have a fall with this. So the balance is again important. Then this is, you can play music. We have discussed the last time also. Then you can start dancing, sitting, lying down. You can behave like a child, lying down flat and moving their hand and legs both, and do it. directions, any direction. Move your body, whatever you like. So it is not like that, your body should be कि हमें सिर्फ exercise करनी है. 1, 2, 1, 2. No, move your body in any direction you like. And again, they're mentioning, if somebody is there with you, you suddenly stop the system and supposedly your one, body is leg is up and this you get freeze for a few seconds. So like for 2 seconds, 3 seconds, I'm not saying you maintain it for some time, just 1, 2 seconds. So you're maintaining your body like this, bend forward, whatever. So this is again, you're feeling happy also. Or nowadays you have got a group of senior citizens or you're going inside the park, so you can use those things also. So this can be one of the good exercise for the same. Then this is banded triplanar toe taps. Again, it is a rehabilitation after 5 months, 6 months. You're doing very well. So you have got bands which you can get online or from pharmacies, any of the pharmacy store. Then you can use those strengthening exercise. But here you don't do it and standing. If you're not able to perform, you can lie down and perform those exercises lying down also. You have those bands, Thera bands or these bands, lie down and perform those exercises with bands also. So you can use, because if you're not able to have the balance in standing, do it in lying position or sitting position. It is not necessarily that you must have those things in standing only, but over a gradual period of time, you can just help those things and this will help you, for your future. Then again, use your dumbbells. If you don't have dumbbells, use half kg water bottle, 1 kg water bottle. So what you were performing earlier with single leg, you can use dumbbell or you can use some movements, punching, moving your hands out, circling, whatever. So in whichever direction you can move it, those things you can perform while sitting also. Again, these are, you have to use those Thera bands and you can use your body to rotate in different direction for your shoulder, for your upper back, for your mid back, for your low back. But important thing comes is you start doing some exercises. If you're not doing, if you're doing it, then graduate it with some heavy weights, with some Thera bands, with some tubes, with some weight balls, not very heavy, 2 kg, 1 kg, 1.5 kg, 3 kg, whatever your body allows you. So you have to just take care of that thing also. Then this is the best exercise. I always recommend to do this chair leg raises every day at least 300 times. 300 times in the sense, you do it 30 times in one go. You raise your leg up, down, raise up and down. Do it 30 times in one set, do it 2 sets. So during the day, you do it 5 times. Morning, 8 o'clock, then 12 o'clock, then 3 o'clock, then 5 o'clock, or then 8 o'clock. If you're not able to do it 300 times, do it 200 times. Start with 50, start with 30, then graduate it with, after a month, you're doing 300 times, because this will help your knee, your hip joint and your muscles around the thigh, and you're able to walk in a very good way. Then side stepping. So once you're able to walk in a straight line, you can use sideways, 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 sideways. So you can do it with wall also. So stand, with the wall. So when wall is there, so you can do walk like, you're standing and then walk sideways, sideways, sideways. Then you walk sideways, sideways, and you can maintain the balance. Move ahead like this, maintain your balance. And then raise one leg, just a second, raise one leg in the air, and you can then maintain your balance with wall only. Then other leg with wall only, maintain the balance. So you can perform that exercise with wall also.
Okay, very nice.
And then planks, once you graduated, you can on your bed, you can get that Swiss ball, and you can either use your pillow or Swiss ball. Then you can use some smaller planks. Then beach ball exercise. But this is, again a graduated program where you can half lying position, you can perform some exercise for your abdominals. So all those things can be done. Then simple exercises, planks, bridges, I have mentioned the last time also. And then hip flexion exercises. Again, these exercises are not necessarily to be done in the same manner only, but whatever position you can maintain, you try to do it. So once जब हम सूर्य नमस्कार की बात करते हैं, So it is not necessarily for everyone to perform in one go. Because हमने काफी टाइम से एक्सरसाइज नहीं की, even my age is supposing 36 and I'm not able to perform, so हम कहते हैं पहले single one break the things, उन components को break करो and do it slowly, perform 5 exercise or 2 exercise one go, then join it and perform the whole one. Similarly over here, if you're not able to perform, do it in breaks. Even whatever you're doing, it will help you. Even if you're not performing the exercise in the same way, it will help you because you are using your muscles, you're using your joints, you're using your brain, you're using your nerves and everything. It is really going to help you. Again, mountain pose, it seems to be a very simple exercise, but when you stand and you raise both of your arms till this position, at this age, will again help you in maintaining your balance. I don't recommend this exercise if you're not able to perform. Of course, just raise your neck, leave it, raise your neck, leave it, and after some time, then use your elbows onto the bed. Child pose if you're able to perform, but at this age, your knee or hip might not allow. Then straighten up these leg in 90-degree pose. Okay, 90-degree pose, and then you try to do the child pose also. So that way also you can do those things. Then again, side exercise, clamshell exercise, where you open up your knees, lying down in side position, and prone leg raise is the common, which most of the people are doing nowadays. So these will help you out, spine rotation, pelvic tilt, and abductor. Again, these are very small and simple movements, but generally that you're performing. But again, do whatever extent it is possible for you. Not necessarily that you are able to perform all those things in a right way in the terms, whatever you see on internet or wherever or somebody has told you, but you perform it, you do it, you use your muscles and joints. So these are the basic exercises which we can perform.
Excellent. Wonderful. Thank you so much for taking it so deep with all these movements and exercises, Dr. Varun. And it will be really interesting. And, say, for example, we've been conducting yoga sessions, regularly for the last 3 weeks. And a couple of questions came related to Surya Namaskar also. Even in my previous experiences, people often, tend to hustle, try to rush up that, when we are going to learn Surya Namaskar. The important thing is that first level is to know that how comfortable you are with each posture one by one, and then see how you can connect a couple of them first, and then, build it into a complete sequence gradually. So that's a very valid observation. And we often, pay attention to that because, more important is your own stability in whatever posture you are. That's the first thing. So thank you so much for, covering it so deep, Dr. Varun. Now, one question. I mean, can we remove the slide for some time? Yeah. Yes. Yeah. So my one of my question is, and often the kind of scenario we are in nowadays. Of course, there are senior citizen homes. We see in US also gradually that culture is catching up in India also. There are special homes for senior citizens when no one is actually around to take care of them. Then how they can manage those things. Those areas we can presume and believe still there are some professional people managing their needs, but wherever families are still together, now the impression, the expectation of parents is, and this is what has been taught to us since childhood, is that when parents can help you take the first step of your life, then why can't you help them take the last steps of their life? Yes. So, but it is much more deeper. The meaning is much more deeper than just the words. So, as kids, as youngsters, how should family train themselves that, fine, now I have a person who's elderly, who's showing the aging symptoms in such a way. So how should they prepare themselves more emotionally? And as well as, couple of points you talked about how to to prepare a home. But then, first thing is emotional preparation and an empathy and a concern that, yes, this is what I need to do. So what is that, do's and don'ts that you advise to children who are supporting elderly parents?
Okay. So here, what comes to my mind directly is this, what happens, there is a loneliness, that comes to the mind of, parents. In the sense, even they are staying with the family, they feel like, sometimes there is a one partner, the other one is, we have lost the other partner and both are there. So sometimes you feel, there is a loneliness. So what happens, I would recommend to the family members that push them up to just go outside the park, meet some friends, meet some neighbors, watch television, spend their time, most of the time, not in lying down or sitting down. Okay, so make them engage in one or the other activity. Moreover, whosoever is there in the home, if you come at 8 o'clock or 7 o'clock or whatever time, then spend 20 minutes, half an hour, whatever time allows you. I'm not saying like this. So you can play with them, you can talk with them, you can just sit beside them, ask for the whole day what has happened to them. Because that will help them to have some confidence, faith, and motivation. Moreover, what happens, the elderly, sometimes they are, little harsh or stubborn, or sometimes they are very strict about their protocols, what they are following from years. Okay, they're not able to change. Even if we tell something, I'm not saying they're not right, they're not wrong. Most of the times, okay, they're right. But sometimes we try to tell them, they say, no, this thing cannot happen. Supposedly I tell them, you have to eat this thing, 1 apple every day. They say, no, मुझे बहुत acidity होती है, तुम्हें नहीं समझ में आता, मैं ये or whatever. But then we have to make them understand in different ways. Then sometimes even if you make them understand, they will not understand those things. So we have to find out the ways, make them realize, show them some videos, because they're most likely watching some videos over the phone or internet. Show them the importance of that, nutrition or some exercise, or going outside, your house, meeting people and all those stuffs. So that will help them out, to come out of that loneliness wala feeling. Moreover, I always tell them the family members should themselves feel that they're not alone. Even if they're alone, they're not alone. Then they should be confident enough, because throughout life, उन्होंने इतना hard time देखा है. They have just bring, their children to up to that much level. They have educated them. They have done lot many things. They have done for themselves also. So from a hard time, they have come to this level. So such a highly motivated, confident people are they. They are, such a, I do not have words for them. There are no words to praise them. But again, how can the thought process has become like this? That they say, no, अब नहीं होता. अरे नहीं, सब कुछ होता है. आप लोगों ने इतने बड़े बड़े काम किए, अब आप आके ऐसा सोचें, नहीं, this is wrong. You have to be, आप throughout life आपने ऐसे किया है, तो अभी ऐसे डाउन होने से क्या होगा? नहीं. तो हमें थोड़ा सा कुछ मोटिवेशन टॉक चीजें, और या फिर आप ऐसे लोग ढूंढिए जिनसे वो खुश होते हैं, उनसे फोन पे बात करके उनको आप इनडायरेक्टली समझाइए कि उनसे बात करें कि नहीं, घर से बाहर जाना है, लोगों से मिलना है, चीजें करनी है, वो सब चीजें. Of course, at एक certain age आती है जब आप अपनी बेड से नहीं मूव कर सकते, but before that you can do lot many things. तो वो सारी चीजें हमें उनको समझानी चाहिए, थोड़ा टाइम स्पेंड करना चाहिए, थोड़ा उनको भी समझाना चाहिए, या कोई और फैमिली मेंबर जो है वो हमें बताएं तो वो भी उसमें हेल्प कर सकता है.
Very valid observations. Very valid observations. Those are indeed very valuable inputs for everyone. I think, for those who are elders who are listening to the entire thing and their family members who are attending this program. So, this empathy and love and care which has been throughout in the family, it makes a lot more sense to maintain that and, develop that confidence in them that you are there for them. That's very important. And then in different ways you can try and communicate to get right things done by them, which are good for their own. So very valid observations, Dr. Varun. So are there certain precautions summarizing the session, taking forward? So for the elders, What will be your final words, precautions? So what are the things which they can avoid and that will be good for them? We've learned a lot about what to do, but let's talk about things which can be avoided for their own good.
So the important thing is, I would like to tell, just a second. So what the thing I can just tell them to do it is like, first of all, they should not feel demotivated. They should feel happy that they have spent such a good time. They have done very good thing to this world, to this country, for their children and for themselves. So they should feel happy about it. And we are so thankful to them, really from core of our heart. And every child is thankful to them that, they have brought them, their children very well. So they should be happy first, rather than see, there are a lot of stresses nowadays in this world, whichever country is there. So because of that stress, their child might not be just, giving that much amount of time or something, they're not with them physically all the time. But we are really, really, really thankful to you. So you should take out the negativity from your mind that, somebody is not there with you. So जो आपने अपना कर्म किया, जो आपने अपना कर्तव्य निभाया, उसके लिए आप सिर्फ ये सोचते हैं कि आपके बच्चे को थैंकफुल होना चाहिए, पर पूरा वर्ल्ड, आपके जितने रिलेटिव हैं, आपके जितने पड़ोसी हैं, आपके जितने लोग हैं, वो जानते हैं आपने क्या किया है, आपने इस वर्ल्ड को कहां पहुंचाया है, इस एनर्जी को कहां पहुंचाया है, वो सब जानते हैं. हमें किसी को शो करने की जरूरत नहीं है, हमें किसी को बताने की जरूरत नहीं है, आपको किसी की बताने की जरूरत नहीं है. हर बंदा जानता है कि आप लोगों ने क्या किया है. तो अपने माइंड से पहले तो नेगेटिविटी निकालिए, बिकॉज वो नेगेटिविटी रहने से आप मेंटली वीक होते हैं, तो आपकी फिजिकली बॉडी वैसे वीक हो जाती है. Then you are not able to perform those actions, you are not able to do exercises, you are not able to talk to anybody. नहीं. So take out all those things from your mind. So पहली चीज तो मैं यही कहना चाहूंगा कि आपको हम बहुत बहुत धन्यवाद देते हैं, बट आप अपनी उस नेगेटिविटी को निकालिए, बिकॉज नेगेटिविटी से नेगेटिव ऑरा जनरेट होता है, हमारी बॉडी की फिजिकल स्ट्रेंथ कम हो जाती है. और जब आप उसको निकाल देंगे, आपकी बॉडी खुल जाएगी, आपका माइंड खुल जाएगा, अच्छे हार्मोन्स रिलीज होंगे, बॉडी में न्यूट्रिशन अच्छे ढंग से एब्जॉर्ब होगा, आप अच्छा परफॉर्म कर पाएंगे. और जैसे ब्रेन से वो नेगेटिविटी निकलेगी, आप अच्छे से एक्सरसाइज कर सकते हैं, आप अच्छे से खा सकते हैं, वॉक कर सकते हैं. देन मोर ओवर छोटे छोटे चेंजेस जो आप पहले नहीं करते थे. सपोजिंगली आप कहते हो कि मेरा कोई फ्रेंड अब हमारे
You've gone on mute, Dr. Varun. Yeah.
चीजें, तो हम उनको ये बोलेंगे छोटे छोटे चेंजेस. जैसे पहले आप पूरा दिन बेड पे रहते हैं, तो हम कहते हैं पहले बेड पे लेटे रहो, फिर आप चेयर पे बैठना स्टार्ट करो, फिर डाइनिंग टेबल पे बैठना स्टार्ट करो, फिर थोड़ा घर में वॉक करना स्टार्ट करो. घर में सीढ़ियां हैं तो 2 सीढ़ियां ऊपर चढ़ो, 2 सीढ़ियां नीचे उतरो. फैमिली मेंबर के साथ हफ्ते में 1 दिन 2 दिन पार्क में आधा घंटा, या कहीं अगर बाहर जा सकते हैं तो वो थोड़ा टाइम स्पेंड करें. देन घर में थोड़ा थोड़ा सा स्मॉलर एक्सरसाइजेस, वेट कप्स के साथ, बॉटल्स के साथ, या कुछ और करके थोड़ी सी एक्सरसाइज स्टार्ट करें. या तो नॉर्मल एक्सरसाइजेस, या योगा, प्राणायाम, मेडिटेशन, या आप आपको कीर्तन सुनना अच्छा लगता है, या कुछ और टीवी में सुनना अच्छा लगता है, या कोई डिस्कवरी चैनल देखना अच्छा लगता है, जो अच्छा लगता है उसमें टाइम स्पेंड कीजिए. ये सारी चीजें आपकी बॉडी को इंटरनली हेल्प करेंगे, क्योंकि मेंटली अगेन द थिंग कम्स इज न्यूट्रिशन, मेंटल एंड फिजिकल. So that again the whole soul of approach goes like that only. So वो चीज में भी आपको हेल्प मिलेगी. अगेन मैं उनको कहूंगा कि वो बाहर निकले, मूवमेंट करें, थोड़ा सा डांस करें. वो लोग बहुत अच्छे से गाना गाते हैं, मतलब पुराने लोग मैंने देखा है बहुत कुछ शायरी भी करते हैं, गाना भी बहुत अच्छे से गाते हैं. तो वो चीज भी वो परफॉर्म करना स्टार्ट करें. नहीं है तो फोन पे अपना एक ग्रुप जो है वो एक जनरेट कर लें, जहां 4 लोग हफ्ते में 1 बारी 2 बारी बैठ के वीडियो कॉल कर सके, बातचीत कर सके. तो वो चीज भी उनके लिए बहुत हेल्पफुल रहेगी. तो ये छोटे छोटे स्टेप्स हैं जहां वो खाने पीने की तरफ थोड़ा सा ज्यादा ध्यान दें, और फैमिली मेंबर्स भी उस तरफ ज्यादा ध्यान दें. जैसे कि उनको खाने का मन नहीं कर रहा है तो आप उनको फ्रूट्स का कुछ मिक्स दे दें, सब्जी का कोई मिक्स दे दें, प्रोटीन्स का कोई मिक्स दे दें. तो इस टाइप से सूप रेगुलर बेसिस पे उनको दे दें. वेजिटेरियन है, नॉन वेजिटेरियन है, उस हिसाब से चीजें कर सकते हैं. तो स्लोली ग्रेजुअली माइंड मोटिवेशन वो जितना ज्यादा अच्छा होगा, आप चीजें अच्छे से परफॉर्म कर पाएंगे, आपकी मसल जॉइंट चीजें सब अच्छे से परफॉर्म करेंगे। तो मेरा तो यही सजेशन है कि ये छोटी छोटी चीजें हैं, नहीं करना है वही मैंने कहा कि अपने साथ किसी ना किसी एक बंदे को रखें जब भी कहीं जाते हैं, जस्ट प्रेजेंस के लिए। अगर आपको वॉकर यूज करना है तो कीजिए, आपको स्टिक यूज करनी है तो कीजिए, शर्माना नहीं है। डाइपर्स की जरूरत है, पहनिए। किसी से कंसल्ट करना है, कीजिए। किसी कोई भी मेडिकल प्रोफेशनल हो, साइकोलॉजिकली हेल्प के लिए आपको चाहिए, यू मस्ट कंसल्ट टू देम। आपकी मेडिकेशन सही टाइम से सारी लेनी चाहिए। कई मेडिकेशन से अगर आपको ड्राउजीनेस लगती है तो डॉक्टर से कंसल्ट करके वो मेडिकेशन रिड्यूस की जा सकती है। सो अपनी इन सब चीजों की तरफ आप जब ज्यादा ध्यान देंगे तो सारी चीजें इंप्रूव करेंगे। और कहीं मेरी जरूरत है, सो आई एम ऑलवेज देयर, शरद सर इज देयर। उसके बाद कहीं भी कोई भी क्वेश्चंस आपको मन में आता है, वी आर ऑलवेज देयर टू हेल्प यू। सो ये छोटे छोटे चेंजेस है जो आप लाइफ में करेंगे तो आप बहुत ही अच्छा, आई वुड से, आने वाला टाइम व्यतीत होगा।
Thank you so much. Thanks a lot, Dr. Varun. Those are very kind and valid words and observations from your end. I think, and I'm sure that people who are listening to this entire conversation will be surely benefited. And understanding with the kind of experience all these words of wisdom are coming from, we can presume and understand that, many such cases are coming to your clinics and you've been, dealing with those. So Dr. Varun, in case anyone has to reach you directly, so what is the best way for them to get in touch with you?
Yeah, so my email ID and website, I think so it is there on the template also. If not, we can share that. And my contact number is there. So whenever they just need any help, they can message me, they can WhatsApp me. So I will directly just contact them up, or they can email me up at my email ID, blessingphysiotherapy.com.
So can you just once again show that one slide in which your coordinates are there?
Oh, just a second.
People can take a screenshot or note down something.
Yeah, just a moment, sir. My things, sir, I'll share on chat.
Yeah, please, you can share it on chat. Yes.
Just a second.
Okay. And meanwhile, anyone who has questions to ask can just keep your question ready. जिनको भी किसी को कोई प्रश्न पूछना है तो प्रश्न पूछ सकते हैं. We will unmute you. And then you can ask your question. So everyone can see. So website of Dr. Varun is blessingphysiotherapy.com. And his email ID is blessingphysiotherapy@gmail.com. You can get in touch with him on his number 9811451892.
And you can WhatsApp also at the same number.
WhatsApp also at the same number. So in case at any time you don't get immediate revert, he may be with patients. So you can, leave a message and you can give a reference of the session that you've attended. And then, we'll be getting back. Yes, so we will share in the group also. Yes, we will share it in our group also. And Dr. Varun, there are a few questions for us. So yes. Mr. Rastogi is there who would want to put a question. Yeah. So Azhar, can we unmute Mr. Rastogi, Mr. Vikram Rastogi? Azhar, can we check K. Vikram Rastogi? Can we unmute him, please? Yeah. Welcome, Mr. Rastogi. Sir.
Thanks a lot, Dr. Varun and Mr. Sharad.
Thank you, sir.
I don't have much to say except for a few things which I have been reading here and there. let me put it up. We people
So you're not fully audible. Can you just come closer to your phone mic, please?
okay. Is it clear now? Better?
Better.
Yeah, just a minute. Yeah. Number one is that 60 plus people, we are the vulnerable people, almost 60% of the world population. And that is a very big number, not even for India, but for the world. This is one. Second is that we talk about Japan, Ikakai, there we find there are three things which they have been doing, which would probably supplement what Dr. Varun had been saying. One is a passion for these people. Second one is a pastime, which he clearly said, gossip, film, dance, or something. Here I would like to add that if they can play with the children, that is going to be magnanimous because it gives you a positive boost, positive energy. Of course, exercise they have not been doing, but they have been taking up a pastime which is in the palm of a profession, maybe farming, maybe fishing, maybe walking. So one is passion, second is the pastime, and third is the food. Of course, if you keep eating nutritive food with minerals and proteins and carbs, it's going to be good. So these are the only three things. So once we have, of course, the mental condition, because the mental condition is the most important thing. You got a positive energy. Then automatically mind would say that you are healthy. You can walk. Whatever he has given is very good as far as exercise is concerned, because we people, I'm about 77, we people face these problems off and on, especially with the shoes, especially with the walking. Another thing, Dr. Varun, I find it myself, in the morning when I put on a fleet and walk a little faster, then it is easier, then there's no problem at all. But sometime in the evening, maybe about 6 o'clock, 7 o'clock, if I want to walk about 1,000 steps or 2,000 steps, then probably I feel that there is something which is happening to my mind, so that the problems that you are facing about imbalance have occurred. So one question would be, why does it happen in the morning, say about 7 o'clock, when I've attended or I'm attending Mr. Kamra's session, when I walk, I can do about 5,000 steps. There's no problem. Hale and hearty, nothing happens. But sometime in the evening, I find that there's imbalance. So this is one question, and I would love to have his comments on this, especially for the senior citizens who are 60 plus. Thank you so much. Lively discussion. Very good informative talk. Thanks.
Thank you very much, sir. Thank you.
So, Dr. Varun, his question is that, in the morning, he's able to walk even 5,000 steps, but later during the day, it becomes difficult. Is that what Mr. Rastogi wanted to ask?
Yeah, it's right. What I'm saying is in the morning, there is no problem of imbalancing. I mean, I'm perfectly all right in the morning, maybe because there's a lot of energy. But in the evening, say about 5, 6 o'clock, if you want to walk even 1,000 steps, then I feel that probably there's imbalance. Probably. I really don't know, but yeah, I feel that there's imbalance. Thank you.
Okay. So the thing is, sir, actually what happens when you get up in the morning, your energy is, entirely different. So you have slept well, or, whenever you get up, so your energy is too high. So you always feel more energetic and you are able to perform those things very well. But usually it should not happen that, by the evening time comes and, your balance reduces. So what happens, I would suggest you, if the things are better in the morning and not at the evening, so probably the lightning factor can be there. That's the first thing. Second thing, I would suggest either, your meal time, lunch time, or, evening, either, there is something which either you are not eating well, maybe, or if you think so, you are eating well. So we have to actually find out the reason why it is happening. You feel energy, there is a low in terms of energy, or there is a balance which is, creating a problem. So if it is a balance problem, then, it should not happen in the morning, it is fine. And in the evening, it is not there, because whatever your balance is, it will be there at the same time also. Yes, it may affect because of your vision, because of your, lighting factors. Maybe you are changing the place. those steps you're doing in the morning and at the evening you're doing at the same place, that can be one of the reason. If you're doing at the same place, then we have to actually find out the reason why it is happening. Because in the morning, if it is fine, that it should not happen, then evening, balance is getting changed. Or probably you're taking some medication, at the lunchtime or at the evening, which is creating a reduce in the balance in terms, your medication have got drug interaction with the other medication or to your system. So we have to check. So either you just create awareness, you find it out, that you are able to know that what is the reason why it is happening, or you let me know, you send some details on, maybe writing down that, this is the routine I'm just having since morning till evening. And what is the change happening in terms of medication, in terms of eating the things. So if there is change happening, so we have to find out the way, what is the exact reason why it is happening. We have to find out the, the exact cause for this.
Yeah. So we need to dig deeper there.
Yeah.
Yeah. So we'll suggest Mr. Rastogi, you can get in touch with Varun, Dr. Varun, and if you need coordinates, I can share it with you. Any other question? Okay. Deepak Kumar ji. Yes. Can we unmute Deepak Kumar ji? Deepak Kumar Jain?
Yes. सबसे पहले तो
Deepak ji, your question, please.
थैंक यू सर. सबसे पहले तो डॉक्टर वरुण को मैं धन्यवाद दूंगा, बहुत अच्छी तरह से उन्होंने समझाया. मैं भी सीनियर सिटीजन हूँ, 66 कंप्लीट कर चुका हूँ. लेकिन क्या ये जो चीज आप पे, मेरे 2 क्वेश्चन है कि क्योंकि मैं अपने अराउंड जो देखता हूँ, मैं ऐसे कोई पेशेंट नहीं देखता. और दूसरा ये है कि ये जो चीजें आपने बताई हैं पेपर में ही बहुत आती हैं, व्हाट्सएप पे भी आती हैं, तो क्या ये हमें नेगेटिविटी की तरफ नहीं ले जा रहे? क्या ये ऐसा लग रहा है कि हम सीनियर सिटीजन हो गए तो हमें ये इन चीजों का ध्यान रखना चाहिए, जबकि ऐसा कुछ है नहीं. मोस्ट ऑफ द मेरे फ्रेंड है वो सब सीनियर सिटीजन है, 78 से लेके मैं भी 66 का कंप्लीट हो चुका हूँ. ऐसा कोई है ही नहीं. सब हम मिलते हैं, एंजॉय करते हैं, घूमने भी जाते हैं, लेकिन किसी को कोई प्रॉब्लम नहीं. रादर मेरे सबसे जो एल्डेस्ट है मिस्टर RL जैन है, वो 78 के हैं. वो तो कह रहे हैं अभी तो मैं जवान हूँ. मतलब कहीं कोई तो मतलब ये कहीं हमें नेगेटिविटी की तरफ तो नहीं ले जा रहा कि भाई हमें ऐसा करना चाहिए? हम
नहीं, नेगेटिविटी की तरफ ले जाने के लिए नहीं हुआ सर. ये इसलिए हो रहा है कि जिन लोगों के साथ प्रॉब्लम हुआ वो आपके सामने तो नहीं आ रहे, लेकिन हम लोग जो इस इंडस्ट्री से कनेक्टेड है हमारे सामने रोज रोज आते हैं, तो इसलिए उन लोगों के लिए एड्रेस करने के लिए है ये. अगर आप स्वस्थ हैं तो बहुत अच्छी बात है, और आपके आसपास अगर कोई लगे तो आप अपनी एनर्जी से उनको और यंग करें, एनर्जेटिक बनाएं, get them to be a part of your group. Maybe with that collective energy they will get even better. So नेगेटिविटी के लिए नहीं है, प्रिकॉशन. जैसे हम हमेशा वेलनेस में यही बात करते हैं that prevention is better than cure, है ना. प्रिकॉशन लेना ज्यादा अच्छा है बजाय कि उस समस्या से बाद में निपटने का, क्योंकि प्रिकॉशन के साथ साथ हम संभल सकते हैं. तो एज जैसे एडवांस हो रही है, कुछ चेंजेस बॉडी में आ रहे हैं, एजिंग कहीं ना कहीं हो रही है. आप ये तो नहीं कह सकते कि मैं उतना ही जवान हूं जितना मैं 20 साल का था. You may not be able to say that confidently, right, yes, sir? So yes, certain people are not able to accept the changes, और उनको ये चीज पे हैरत होने लगती है, शुरू होने लगती है कि अरे यार मेरे साथ ये क्या हो रहा है. So to enable them to understand the passing of time, the aging process and knowing what to change in your life, और अगर कुछ indicators आ रहे हैं तो घर को किस तरीके से तैयार करना है, फैमिली को किस तरीके से उसके लिए प्रिपेयर होना है, ये एक बहुत सर बड़ा इंपॉर्टेंट सोशल सब्जेक्ट है.
नहीं, आपने बिल्कुल सही कहा, मैं बिल्कुल एग्री करता हूँ इसको. लेकिन मतलब जनरली ये पढ़ने में आ रहा है और व्हाट्सएप ग्रुप में भी आ रहा है, और ऐसे कई सेमिनार भी मैंने अटेंड करे. वो ठीक है, बिल्कुल अवेयरनेस के लिए होना चाहिए, क्योंकि काफी परसेंटेज तो है ना ऐसा इसको जो अफेक्ट है, और कुछ ना कुछ तो जैसे जैसे एज होती है आप डिटेरियोरेशन तो होता ही है. लेकिन आदमी को मतलब बिल्कुल पॉजिटिव होकर काम करना चाहिए, मेरा कहना है. आज
मैं इसके लिए ना बीच में एक चीज बताना चाहूंगा. शरद सर बोले?
प्लीज कैरी ऑन डॉक्टर वरुण.
सो मैं एग्जांपल देता हूं. अभी एक्चुअली एक पेशेंट है, बहुत यंग थी, उनको कैंसर हुआ था. अब कैंसर वर्ड सुन के घबरा जाते हैं, और किसी लोगों को बोलते हैं मेरे घर में कैंसर वर्ड यूज भी मत कर लेना. ठीक है ना, नेगेटिविटी आती है. अब उसको कैंसर हुआ, शी वाज अ गर्ल, अ वेरी यंग गर्ल. कैंसर होने के बाद थोड़ी डिफिकल्टीज थी, काफी ज्यादा थी, अनट्रीटेबल था, बट समहाउ शी सर्वाइव्ड। अब आपको शायद पता नहीं होगा, मैं बताना चाहता हूँ, तो जितने भी कैंसर हॉस्पिटल्स होते हैं या कैंसर रिलेटेड इंस्टीट्यूशंस होते हैं, सो वहां पर कैंसर जिसको होता है वो अपने आप में ही एक मेंटल ट्रॉमा होता है। जैसे पहले दिन पता लग जाए ना कैंसर हो गया है, बंदा 50% वही गॉन, कैंसर हो गया है। सो वहां पर एक टीम्स क्रिएट की जाती हैं, जो जैसे ये लड़की, द गर्ल हैज सर्वाइव्ड, सो दे हैव क्रिएटेड अ टीम which we called as supporter to the cancer survivors or the patients. उनका काम होता है कि उनके मेंटल लेवल को, उनकी मोटिवेशन को इतना हाई रखना कि वो सैड या बैड फील ना करें। अब हम जो आप ये कह रहे हैं कि भाई नेगेटिविटी, आप एक एग्जांपल की बात करें तो जो बंदा सरवाइव कर गया है वो, तो उसे तो ये सोचना चाहिए मैं कैंसर वाले लोगों से तो दूर ही रहूं। आप समझ रहे हैं कि भाई नेगेटिविटी और ज्यादा आएगी। बट शी हैज डिसाइडेड, अभी शरद सर ने यही कहा कि आपके पास कोई आके ये कहे कि भाई ये क्या हो रहा है, तो आप उसको एक एनर्जी का इतना बड़ा गोला दे के फेंके कि भाई वीक नहीं हो रहे हो आप, और यंग हो रहे हो। तो ऐसे ये जो कैंसर की जो टीम बनी इन बच्चों की, सर्वाइवर्स की, वो उन हर एक बंदे को जाके हॉस्पिटल में डेली सर्व करते हैं, बिल्कुल फ्री ऑफ कॉस्ट, एनर्जी देने के लिए कि नहीं, you have to live this world, you have to fight with this disease and you have to just conquer the world. जो भी लाइफ है, देखिए कैंसर पेशेंट्स का पता नहीं होता, एक दिन है, 2 दिन है, 2 साल है, 20 साल है, 50 साल है, यू नेवर नो। पर आपको भी एक चेंज के लिए, आप, मुझे पता है ऑलरेडी आप ये सब चीजें कर रहे हैं, पर आप अपनी एनर्जी को 10 गुना 100 गुना बढ़ा दीजिए। कोई ऐसा कहे, उसको उस एनर्जी को दूर फेंक के सबको मोटिवेट कीजिए सर।
नहीं, बिल्कुल सही कह रहे हैं सर, मैं बिल्कुल समझ रहा हूँ, लेकिन मैं एक जनरल जो मैंने अनुभव करा वो बता रहा हूँ।
हाँ नहीं सर, आप सही कह रहे हैं, बस उसमें ये होता है कुछ चीजों को हमें इग्नोर अपना काम करते चलिए। आप लाइफ में भी इतनी सारी चीजें करते हैं, जहां आपने जॉब, प्रोफेशन, अपना बिजनेस किया होगा, बहुत सारी नेगेटिव एनर्जीज आती है, पर आपका मुद्दा स्ट्रेट फॉरवर्ड लाइन, रीच टू दी डेस्टिनेशन, बस। तो यहाँ पर भी हमें बस उसी हिसाब से कि हमें लोगों को मोटिवेट करना है, हमें खुश करना है। आपकी जो चेहरे पे जो नूर है, जो एनर्जी है, जो ऑरा है, उससे और सारे लोगों को हम बहुत खुश कर सके, मोटिवेट कर सके।
थैंक यू सर। मैं आज की तारीख में भी एक भी टैबलेट नहीं लेता सर। बिल्कुल,
बहुत अच्छी बात
सर, वेरी गुड थिंग, हम बहुत खुश हैं ये सुनकर सर।
थैंक यू सर, बहुत अच्छा प्रोग्राम अरेंज कर रहे हैं। मैं कई मतलब क्लासेस इस तरह के वर्कशॉप ज्वाइन कर चुका हूँ। वेरी नाइसली एक्सप्लेन।
थैंक यू सो मच। Thank you so much, sir.
Thank you.
So we have couple of groups running for support in WhatsApp. हमारा एक योगा ग्रुप चल रहा है and we are doing continuous yoga. Kala sir will be sharing more details about. Apart from that, we have groups on diabetes, technical wellness, obesity. There's so many different groups are running, and we'll be planning to start some more new initiatives also to reach out to all different kinds of people and different age groups. So stay tuned, keep attending our programs, and we are there for you for all the support. आपको कुछ किसी भी तरीके की जरूरत हो, मदद हो for related to your health issues, we would try our best to help you out. So that's it for from our side. Thank you so much, Dr. Varun, for being with us. It's over to you,
I think so there is one more question from somebody, Savinder sir. I think so there was some, I don't know.
Has it been put directly to you? I'm not able to see in my...
No, I think so. No. Somebody was raising hand, I think so.
Acha, okay. So, Savitendri, you had a question?
Yes, sir. Namaste, sir. Good noon. Network issue है sir. बैठो.
Can we have your question?
हाँ सर, थोड़ा राइटिंग ट्रेमर की दिक्कत थी, उसके लिए कोई हो स्ट्रेचिंग तो सर बता दें सर।
So आपने कांटेक्ट सर डॉक्टर वरुण के नोट कर लिए हैं ना?
यस सर।
तो आप एक बार पर्सनल एक ईमेल में डिटेल्स डाल दें एंड देन वी विल बी इन टच विद यू।
ओके सर।
यस वेरी गुड।
ओके
या थैंक यू सो मच। Over to you, Kala sir.
Thank you so much. Thank you, Dr. Varun. इतने बढ़िया से
Thank
आपने
you, thank you,
हमारे
sir.
को बताया जो इश्यूज एल्डरली को आते हैं। और मैं दीपक जी ने जो भी कहा उसके बारे में सिर्फ ये कहना चाहूंगा कि एल्डरली लोगों में काफी प्रॉब्लम्स आती हैं बिकॉज ऑफ ओवर कॉन्फिडेंस। इट्स गुड टू बी कॉन्फिडेंट, बट वन हैज टू बी केयरफुल एंड नॉट बी ओवर कॉन्फिडेंट। मेरे खुद के परिवार के अंदर एक किस्सा हुआ था ऐसा। मेरे ब्रदर इन लॉ जो 80 साल के थे, उनके ब्रदर भी उनसे 4-5 साल छोटे, वो लोग मंदिर जा रहे थे और उनके बेटे ने बोला भी आप मंदिर जा रहे हो, किसी को साथ ले जाओ, अपने सर्वेंट को। बट दे सेड नो, वील मैनेज, वी आर बोथ यंग, वील मैनेज। And the elder brother had a fall, younger could not manage, and that led to a lot of complications over a period of time. So सिर्फ ये इसलिए कि भी it's good to be confident, अपने आप को हेल्दी रख रहे हैं हम लोग, बहुत अच्छी बात है। बट एल्डरली लोगों की पॉपुलेशन बढ़ रही है, ज्यादातर में हम लोगों के बच्चे हमारे साथ में नहीं है, दूर रह रहे हैं। तो इट्स मोर इम्पोर्टेंट फॉर अस टू टेक केयर ऑफ आवरसेल्व्स एंड not get into issues which are avoidable. That's all I would say. Going further, I would like to just share my screen. Is my screen visible?
Yes. Your screen is visible, sir. Yeah.
So what we understood today, we understood there is a need to accept the fact that with age our body slows down. जैसे जैसे उम्र बढ़ती है हमारी, हम अपने आप को इतना भी जवान समझें, हमारी बॉडी डेफिनेटली स्लो डाउन होती है, क्योंकि नेचर ने वैसा बनाया है हमारे को। हमने समझा कि बैलेंसिंग के लिए और कोऑर्डिनेशन के कैसे करें, उसकी क्या जरूरत है, कैसे प्रैक्टिस करें। हमने सीखी मसल स्ट्रेंथनिंग एक्सरसाइजेस। हमने ये भी देखा कि हाउ टू मैनेज एंड अवॉइड बाथरूम फॉल्स, कि अपन क्या गैजेट्स हैं जो कि रेडीली अवेलेबल है मार्केट में, which we can use and avoid lot of pain for ourselves and also for our sons, daughter and family members. और साथ ही हमने सीखा कुछ प्रिकॉशन जो एल्डर्स को लेने चाहिए और कुछ लेसन हमारे फैमिली मेंबर्स के लिए टू अवॉइड फॉल्स। एक बार फिर आपका बहुत बहुत धन्यवाद डॉक्टर वरुण फॉर एक्सप्लेनिंग थिंग्स सो ब्यूटिफुली। थैंक यू सो मच। अब जो शरद जी ने बात करी थी, हम पिछले करीब 20-25 दिन से योगा के ऊपर वेबिनार्स कर रहे हैं, योगा फॉर ऑल राउंड वेलनेस। इस हफ्ते का हमारा टॉपिक रहेगा फोकस एरिया स्पाइन। तो स्पाइन के ऊपर हम फोकस करेंगे। तो जिन लोगों ने ज्वाइन नहीं किया, प्लीज डू फील टू ज्वाइन अस। ये सोमवार से शनिवार तक सुबह 7 से लेकर 8:15 या 8:30 तक होता है। और स्पाइन का जो सेशन है ये हम शुरू कर रहे हैं 7 नवंबर से। इस पे एक्सपर्ट रहेंगे मिस्टर शरद कामरा। इसके साथ ही योगा और वेलनेस पे काउंसलिंग के लिए आप आ सकते हैं। विजिट आवर वेलनेस रिसोर्स सेंटर एट बख्शी भवन 532 जयपुर, 9 बजे से 2 बजे के बीच में कभी भी। तो प्लीज मेक यूज ऑफ दिस फैसिलिटी दैट वी हैव। एक बहुत इंटरेस्टिंग चीज मैं शेयर करना चाहूंगा आपके साथ में। अभी तक हम लोग वेबिनार कर रहे थे, अब थोड़ा माहौल सुधरा है। तो वी आर प्लानिंग फॉर ए इन पर्सन इवेंट। ये होगा 10 दिसंबर को। मैं अभी से इसलिए बता रहा हूँ कि इस इवेंट में हम लोग लेके आ रहे हैं लाफ्टर योगा के जो फाउंडर है ग्लोबली, डॉक्टर मदन कटारिया। इनको आप लोगों ने, कुछ लोगों ने देखा होगा प्रोग्राम में, आमिर खान साहब के साथ में जो आता था उसमें ये आए थे। और 110 से ज्यादा देशों में दुनिया भर में इनकी फॉलोइंग है। ये इवेंट है 10 दिसंबर को, जो कटारिया साहब खुद कराएंगे फिजिकली प्रेजेंट होकर के। सो प्लीज कीप द डेट फ्री। अपने रिश्तेदारों को भी बताइए। डेट तो 10 दिसंबर है। टाइम और लोकेशन हम अनाउंस करेंगे, क्योंकि सर्दियों का टाइम है, कैसा माहौल रहेगा, मौसम कैसा, उसके हिसाब से हम जगह और टाइम डिसाइड करके फिर से बताएंगे सबको। सो कीप दिस इन माइंड। लाफ्टर योगा प्रोग्राम विद डॉक्टर मदन कटारिया in person on Sunday 10th of December. It's not Sunday, my apology, it's Saturday. Then we have volunteering opportunities at My Correct the Wellness Code Foundation, जो कि बख्शी भवन न्यू कॉलोनी में है। और इसके लिए आप में क्या चाहिए? You are interested in wellness, you want to work with team members in India and US. हमारी शाखा, we have an associates in US also. आप सोसाइटी के लिए कुछ करना चाहते हैं, काफी हम में से सीनियर लोग हैं जिन्होंने अपना जो प्रोफेशनल कैरियर है बहुत अच्छे से निभाया. नाउ इट्स टाइम फॉर अस टू गिव बैक टू सोसाइटी. अगर हम देखिए हमारे बचपन से आज तक तो समाज ने बहुत कुछ दिया है हमारे को, एंड एट सम स्टेज वी शुड थिंक अबाउट गिविंग बैक टू सोसाइटी. So do call in 7399951157 या आप हमें मेल भी लिख सकते हैं info@thewellnesscode.org. हम धन्यवाद देना चाहेंगे हमारे पार्टनर्स का, हमारे स्ट्रेटेजिक नॉलेज पार्टनर्स IHMR यूनिवर्सिटी और IS यूनिवर्सिटी. जो कटारिया साहब वाला जो प्रोग्राम है उसके अंदर हम सहयोग पूरा मिल रहा है IS यूनिवर्सिटी का. दे आर आवर स्ट्रेटेजिक पार्टनर्स. Then we have community partners, MFJCF, Bitosa, Journalists Association, and all these bodies, they help us out. Our partners, we have area development partner, corporate wellness partners, NGO partners, and wellness partners. We have pro bono partners, जो कि हमारे को मदद करते हैं legal issues में, technical issues में, financial issues में. इन सब का हम बहुत बहुत धन्यवाद करते हैं. Our team of doctors, Dr. Sudhir Bhandari ji, Dr. Shira Nambiar ji, जो हमारे advisors हैं, and हमारा doctor chairs, Dr. Sunil Jain, Dr. Rashmi Jain और Dr. Chavi Mehra, जो कि हमें day-to-day basis पे guide करते हैं, advise करते हैं. Our core team of advisors, Mr. Arvinder Multani, Adi Gurudas ji, Jitendra Gautam ji और आरुषि जैन जी, इन सब का भी हम तहे दिल से धन्यवाद करते हैं. Our ambassadors, Mahir Pratap Sharma ji, Neeta Buchra ji, और मेजर जनरल CP सिंह साहब. मैनेजमेंट टीम, जैसा कि आपने शुरू के वीडियो में देखा, मिस्टर नरेंद्र बख्शी, जो कि हमारे प्रणेता है इस ऑर्गेनाइजेशन के, who is the fountainhead for this and who is himself a living example. He is also close to 80 years and travels globally, internationally even today, all alone without any issues. मैं विक्रमादित्य विद्याकांत काला, then शरद कामराज साहब अभी मिल चुके हैं. तो शाह गर्ग जी, उमरदीन जी और मोहम्मद अजहरुद्दीन जी, ये हमारे को टेक्निकल और एडमिन सपोर्ट प्रोवाइड करते हैं. इन सबका बहुत बहुत धन्यवाद. एक बार फिर से कल से लेकर के शनिवार तक सुबह 7 से 8:15 हमारा प्रोग्राम रहेगा योगा के ऊपर, विद फोकस ऑन स्पाइन हेल्थ. एक्सपर्ट शरद कामरा जी, तो प्लीज डू ज्वाइन इन. Once again, in-person program 10 December, Dr. Madan Kataria के साथ laughter yoga in natural environment, open surroundings in one of the public parks. Once again, volunteering opportunity, please do call 7339951157 या हमें मेल भी भेज सकते हैं info@thewellnesscode.org. You can follow us on YouTube, Facebook, Instagram, LinkedIn. और हमारे वेबसाइट पे जाएंगे तो ये सब कनेक्शंस आपको मिलेंगे. तो प्लीज डू जॉइन अस, डू एनकरेज अस, डू सपोर्ट अस. एक बार फिर माइक्रेट द वेलनेस कोड फाउंडेशन की तरफ से मैं आप सबका बहुत बहुत तहे दिल से धन्यवाद करता हूं कि आप लोग आए और हमें एनकरेज किया आपने. सो थैंक यू सो मच फॉर दिस. और लाफ्टर योगा का हम सेशन शुरू करने वाले हैं. कैन आई रिक्वेस्ट ऑल पार्टिसिपेंट्स टू just maybe can we unmute all and at least end our session with a laughter. All we need to do is Thank you so much everyone. Thank you for joining.